welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, the definition of health goes way beyond the absence of disease. The pandemic has put mental as well as physical health and wellness into sharp focus. Awareness of health issues is important for visibility and community. Now, the absence, inaccessibility or inaccuracy of information about chronic illness causes a lack of knowledge, which is worsened by myths and fear, as well as increased social media trust. Awareness of disease and symptoms is essential for screening and early detection. If members of the public are aware of a disease and its symptoms, then they're more likely to take action to prevent it from happening to them or go for healthcare providers for checkup. Also, chronic conditions like diabetes, heart disease come with complications associated with it. Hence, it's essential to identify symptoms early and take corrective steps. Expert advice will help our viewers to garner correct information and then act accordingly. So let's now go across to the doctors who are joining us on the show. We're joined by Dr. Ashish Jha, Chief Consultant, Cardiologist, Heart Hospital, Magad Mithila Cardiac Center, Patna, and Dr. Sachin Hoskatti, Consultant Physician, Hoskatti Medical Center, Hubli. Thank you so much, doctors, for joining us on the program to talk about these very important issues. And Dr. Sachin, I'd like to start with you. Now, diabetes can lead to serious complications. What are diabetic emergencies and how to prevent a diabetic emergency?
Yes, as we all know, diabetes can lead to serious health complications, both acute and chronic. Well, the three main important diabetic emergencies are hypoglycemia, diabetic ketoacidosis, and hyperglycemic hyperosmolar state. Hypoglycemia is a very common entity seen in our day-to-day practice. Mild hypoglycemia can be treated at home with simple sugar syrup solutions, etc. Whereas severe hypoglycemia needs to be addressed in a hospital ER room with IV dextrose and other maintenance therapy. Coming to the other diabetic emergency, diabetic ketoacidosis. Diabetic ketoacidosis is a very important medical emergency and can lead to coma and death if left untreated. Identifying diabetic ketoacidosis is very important, and the patient needs to be taken to an intensive care unit and with close monitoring of the blood glucose, correction of the fluid deficit which is there, intravenous insulin, appropriate antibiotics, and most importantly, treatment of the underlying cause which has led to diabetic ketoacidosis. The third and other important medical emergency in diabetes is hyperglycemic hyperosmolar state, HHS as we call it. It is similar to diabetic ketoacidosis, however with the absence of ketone bodies and with even more profound fluid deficit or dehydration. In this state, the patient needs to be addressed again in an intensive care unit with appropriate fluid management, which is even more severe compared to diabetic ketoacidosis, correction of hyperglycemia with intravenous insulin, appropriate antibiotics, and most importantly, as I said, treatment of the underlying cause which has led to this condition. Having said all these three emergencies, hypoglycemia, diabetic ketoacidosis, and HHS, we need to address the issue that maintaining euglycemic state and preventing either conditions, that is either hypoglycemia or hyperglycemia, forms an important part of diabetes management program.
All right, so very important for those suffering from diabetes to be aware of all these emergencies that can take place. Dr. Ashish Jha, a heart attack can lead to death if it's not treated on time. So what are the warning signs or symptoms of heart attack or stroke, and also are heart attack symptoms different in women and men?
Yeah, first of all, warm regards to you, Gargi, and all the viewers of Health and Wellness program.
Thank you.
The classical symptom of heart attack is chest pain. Chest pain, which is usually described as crushing, heavy or chest heaviness or crushing type of pain. It usually starts at the center of the chest and radiates to both arms and shoulders, especially to the left arm, and might radiate to the right arm also, and sometimes to neck and jaw. Any pain which goes below umbilicus is not considered as cardiac. So this is a classical symptom, but it might also have a shortness of breath, transient loss of consciousness, even some epigastric discomfort or bloating of abdomen, some patient might have extreme palpitation, lethargy, or fatigability. Now, coming back to your second question, that is very important. In women, in elderly, and in diabetics, heart attack may present silently. They might not have any symptoms. We have seen some patients coming after 1 to 2 weeks of heart attack with shortness of breath and never had chest pain. But there are some symptoms which can identify heart attack in these patients, such as they usually complain of nausea and vomiting, extreme diaphoresis, profuse sweating, cold sweats, and they usually have epigastric discomfort, bloating. They feel that it is most probably acid peptic disorder. So they might have these symptoms along with shortness of breath. They might have transient loss of consciousness. Because these group of patients, women, elderly, and diabetics, present with atypical symptoms of chest pain that we call angina equivalent, so physician at some level might miss the diagnosis, which is very important. So it is very important to identify these symptoms and to do ECG as early as possible in this patient to identify heart attack in these patients. Moreover, because of these atypical symptoms, the outcome of heart attack is relatively worse in female and in diabetic patients. Over to you, Gargi.
All right. Well, thank you for that, Doctor. Now, Dr. Sachin, coming back to the issue of diabetes, in which type of diabetes is severe hypoglycemia common, and what steps should people with diabetes follow to avoid such instances?
Yeah. Coming to this important question, as we all know, hypoglycemia is quite common and quite severe in patients with type 1 diabetes. Well, an important part of diabetes management and prevention of hypoglycemia is patient participation in his treatment plans or the diabetes management. Most importantly, the patient needs to have an appropriate, well-balanced diet, a regular exercise schedule, regular medical evaluation, appropriate adherence to the medicines, drugs, dosages, as well as the timings. Most importantly, through this program, I would like to say that patient needs to actively participate in their diabetes management. A simple measure being self-monitoring of blood glucose at home goes a long way in preventing hypo or hyperglycemia. Patient education and awareness regarding hypoglycemia, early identification and appropriate treatment is very important in the prevention of hypoglycemia.
All right, so those are some of the ways that one can manage the disease. Dr. Ashish Jha, many heart attack patients actually die before reaching the hospital, and the sooner the person can get to the emergency room, the better chances are of survival. So what can a person do to help himself during a heart attack? How much time should treatment start in, and should he go to the nearest hospital or a hospital with cardiac care facilities?
Yeah, this is a very important question, especially in Indian scenario where many peripheral district hospitals, especially in Bihar, Jharkhand and Orissa, don't have a proper cardiac facility. Proper cardiac facility is a place where primary angioplasty can be done. So we can just divide the patients into two groups. Suppose a patient is there who lives at a place where he can reach a cardiac center within half to 1 hour. He should certainly go to a cardiac center where immediately ECG can be done, and if he is having a heart attack, that is ST elevation, MI or anastemia with ongoing chest pain, then he can undergo angiography and get angioplasty done as early as possible. This is a very important thing, as early as possible. The guideline says that at a cardiac care facility where primary angioplasty is available, this should be done within the coronary opening should be done, that is wire crossing and revascularization should be done within 60 minutes of first medical contact, with ECG being done within 10 minutes. But suppose the patient lives at a place where he can't reach a cardiac center within 1 to 2 hours, then he should immediately go to a center where a physician is available, and he will be given a loading dose of some cocktail of medicines such as dual antiplatelet therapy, atorvastatin, dose of low molecular weight heparin or heparin, unfractionated heparin, and he will be advised to undergo thrombolysis, that is a drug which dissolves the clot which causes a complete blockage of coronary artery. So if he gets all these primary treatment done, and then he can, if he is stable, he can be transferred to a center where angiography and angioplasty can be done within 3 to 24 hours of chest pain. This is what the guideline recommends by the American College of Cardiology, by STEMI India project, which was done in India with over a large group of patients, and also by the European Society of Cardiology.
All right. Now, Dr. Sachin, it is said that diabetes is a potential silent killer. We also know that it's a ticking time bomb. That's something we hear again and again from experts when it comes to diabetes in India. So we can act if there are some symptoms, but can diabetes complications start appearing suddenly without warning?
Yes, I think it's well known that diabetes is a silent killer. Having said that, there are 84 million people worldwide living with pre-diabetes. These have been undiagnosed and or not been evaluated. These patients have never got their screening done, and these patients are quite prone for developing overt diabetes. There are 84 million people worldwide. That's quite a significant number. Patients with high risk factors such as obesity, strong family history, sedentary lifestyle, or red flag signs like nocturia, unexplained weight loss, etc., should undergo early screening for early diagnosis of diabetes and prevention of complications. As we all know, poorly managed diabetes can lead to devastating complications, end organ damage, and serious morbidities and mortality. Having said that, when we speak about complications, I think we are already dealing with an advanced stage of diabetes. All the treatment modalities are focused on prevention of complications. Diabetes usually provides us ample opportunities and ample time for the patient as well as the healthcare provider to rectify all the problems and prevent complications. Despite all these important issues which are there, which are in practice, we still see a lot of patients ending up in the emergency room or the ICU setting with serious problems or events such as acute myocardial infarction, diabetic kidney disease, CKD, diabetic foot with sepsis, etc. So it is very important to create awareness amongst the public for early screening and prevention of complications.
All right, important to go in for that early screening. And now, Dr. Ashish Jha, a heart attack is a deadly medical emergency where essentially your heart muscle begins to die. So what are the treatment options available for a heart attack?
Yeah, for a heart attack, there is a very common saying in medical terminology that time is muscle. The more time is lost, the more your heart's pumping capacity gets lost. And that is the very important thing. That is what I have said in earlier talk, that get the primary treatment as early as possible. The guideline is to get ECG done within 10 minutes of first medical contact. And if you are at the center where this is available, and at cardiac center, the facility of angiography and angioplasty should be available 24/7. So whenever you are, if you are at this center, get angiography and angioplasty done. Many a times we see patients when we are telling that this is an emergency and get angiography done immediately. Then we see there is a hesitancy of most of the attendants and patients. First in the diagnosis that most probably this is acid peptic disorder, it's not a heart attack. The second thing is regarding the acceptance that he might need an emergency angiography. The point lost here is that the more time you lose in getting angiography done and in clearing that block, the more your heart muscle get damaged. And once your heart muscle get damaged, usually it doesn't recover. If it is done within a certain set window period of within 12 hours or maximum up to 24 hours, there is a chance of recovery. But after that, the chance of recovery is usually lost. So get it done as early as possible. If you are not at that center, get at least thrombolysis done with primary treatment done, and then you can go to a center where all these intervention can be done. Moreover, with the advent of all these treatments with proper control of blood pressure, sugar, proper dual antiplatelet therapy, that is blood thinning medicine for at least 1 year, and statin for lifelong statin. With advent of all these treatment and with if you are living under a proper supervision of cardiologist, the mortality, that is the death rate of heart attack, has decreased from 25 to 30% to 2 to 3% nowadays over the course of last 30 years. This is really a boon what we get from all the trials from the scientific studies. So we should follow the cardiologist's advice and to undergo treatment as advised by them.
All right, and also go in for checkups regularly as well. Thank you, doctors, for answering all those questions. We'll slip into a short break now and come back with more. We're discussing heart health and managing diabetes. Stay with us. Welcome back. You're watching Health and Wellness, Myth versus Fact. We're talking about heart health and diabetes and managing emergencies at home and being aware of such emergencies. Let's go across to our doctors. Dr. Sachin Hoskatti, diabetes and heart disease go hand in hand. Are people with diabetes at high risk of getting a heart attack, and do they exhibit different types of symptoms?
Yeah, coming to the first part of the question, yes, patients with diabetes are definitely more prone for cardiovascular diseases. A close link exists between cardiovascular diseases and diabetes. There have been n number of studies, including the famous Framingham study, which shows that cardiovascular diseases are significantly more common in patients with diabetes. Up to 2/3 of the people with diabetes, or up to 66% of patients with diabetes, will eventually or might have cardiovascular problems in their lifetime. And patients with diabetes are 2 to 4 times more vulnerable to have cardiovascular disease or events. Cardiovascular disease is the commonest cause of death in patients with diabetes. Well, coming to the second part of the question, how is it different in patients with diabetes and why we need to focus on this particular problem in patients with diabetes? Here we go saying that patients with diabetes present quite early, at an earlier age with cardiovascular disease. The disease can be more severe in patients with diabetes. The chances of complications, cardiovascular disease and complications per se in patients with diabetes are more. Having all the comorbidities like dyslipidemia, obesity, hypertension, etc., these people are more prone for complications as well as the challenges associated with.
All right. Now, Ashish, Dr. Ashish Jha, if you could tell us, about cardiac care and how people spend time recovering in hospital after any sort of cardiac procedure, but then they need to continue to take care of themselves. And this could be quite an adjustment to go from, your normal routine to adjusting to activities after a heart surgery. So what care should be taken post-cardiac procedure?
Yeah, cardiac rehabilitation is now a major aspect in for the long-term quality of life for any patient. So again, in this category, I will divide patients into two groups of patients. First group consists of those patients who came hospital during the early phase of window period, and they got angiography and angioplasty done at the early stage. What happens to these patients? Their heart's pumping is preserved. So usually in this group of patients, we just try to mobilize them after 1 to 2 days of their angioplasty, and then we discharge him after mobilizing. If he's not having any chest pain or breathing difficulty, we usually discharge these patients after 3 to 4 days of admission. At home also, we don't tell these patients to take rest. We tell them these patients to avoid heavy work, but to be as active as possible. After 1 to 2 weeks, we tell these patients to start walking with an average of 15 minutes per day and gradually increase every week, increase it by 5 minutes every week, and try to walk for at least half to 1 hour daily. Try to do it daily, but at least for 5 days in a week. That is what the recommendation says. Now, these group of patients do very well because they return back to their normal life very quickly, and they don't have any physical limitations. The second group of patients are those whose heart's pumping got deranged. What we call in technical terms is left ventricular ejection fraction is less because of their delayed presentation or because of a massive heart attack. These group of patients usually are troublesome because they usually develop shortness of breath. They might require readmission because of their heart failure symptoms later on. In this group of patients, we try to mobilize more gradually over a course of 1 month. And then we tell these patients to have to limit their fluid intake. And of course, in all patients, we prescribe them we give them a proper diet chart. Now, the third group of patients is there who underwent coronary artery bypass surgery. This group of patients also take a slightly longer time, take 1 to 2 months to recover fully and to be mobilized. Now, many hospitals are running cardiac rehabilitation program. What is a cardiac rehabilitation program? What they do is that even now we are going to start it. What we are doing is that after 2 weeks of heart attack, we just we tell the patient to run on a treadmill. And we do a symptom limited test to see what the effort tolerance of the patient is, and patient can do the regular exercise on the basis of their effort tolerance. Apart from the physical limitation, what is very important in patients with heart attack is emotional limitations. That also, many patients develop depression after heart attack. They have negative thoughts. This also has to be tackled by all the cardiologists. What is important is a family support, the society support, and if they require, they should consult a psychiatrist. So our major objective for all these patients is to get this patient back to a normal life as early as possible.
All right, so that's very important on how to take care once you have had that, have had an operation or some sort of a procedure done, and mental health also, doctor, that's a very important aspect of recovery as well. Well, thank you so much, doctors, for taking out time and answering all our questions on managing diabetes and heart care, and also what to watch out for in case of emergencies. So thank you all for watching at home. Goodbye.